Hi there, I'm Dr. Greg Mishkel, the Division Chief of Cardiology here at NorthShore, and I'm excited today to talk to you about and show you a new technology that we're using probably over the last couple of years to define patients' heart arteries and determine the presence of disease. Think of this as three-dimensional technology that potentially can replace things like stress testing or nuclear examinations. So let's take a look at one of our patients here. We've de-identified the patient, no patient information. And these are the three coronary arteries that this patient has. This is the right coronary artery, this is the left coronary artery, and this is the circumflex artery that goes into the back of the heart. And these arteries not only are depicted in terms of what their normal anatomy looks like, but are also modeled by where the arteries might narrow, as well as what the impact of blood flow is. So if we concentrate on just this important artery here, which is called the left anterior descending artery, and you can see an area of blue, and that artery is wide open, and the area of blue indicates normal flow. And then we start getting to yellow, and then to orange, and then to red, and obviously that's color-coded, indicating not only do we have areas of narrowing here, but we also have concordant with the areas of narrowing diminished blood flow. So you see this number 0.67 here, and if we compare that to blood flow upstream from the narrowings, so blood flow is about 98% of normal here and 67% of normal here, indicating that this narrow that extends into this branch is significant. If we look at the main artery here, we can see that orange blood flow and this entire length of this main artery that runs down the front part of your heart has diminished blood flow. It's red, and blood flow is only about 53% of normal relative to normal up here, 98%. And because this area of narrowing occurs before all branches in the main pumping area of the heart, we call that the widowmaker. So this patient who presented with minimal symptoms went for a CT scan, also had a very strong family history of heart disease, and we learned from that CT scan that he has one vessel, two vessel, in fact the artery here is occluded, three vessel heart disease, and will be going for emergency bypass surgery.